fois que vous vous joignez à nous, veuillez changer votre écran au mode Speaker en anglais pour pouvoir mieux voir les porte-paroles. Ce bouton est situé en haut à la droite de votre écran. Reporters with accessibility needs can pin the interpreters Diana and Stephanie or follow along on YouTube. Les journalistes ayant des besoins en matière d'accessibilité peuvent épingler les interprètes Diana et Stephanie ou suivre la diffusion sur YouTube. Today, we'll be hearing remarks from the Medical Officer of Health at Ottawa Public Health, Dr. Vera Etches, and also available to answer reporter questions after Dr. Etches' remarks will be the Manager of Immunization at Ottawa Public Health, Marie-Claude Turcotte. Nos porte-paroles aujourd'hui sont la médecin-chef en santé publique à Santé publique Ottawa, Dr. Vera Etches, et également disponible pour répondre aux questions des journalistes après l'intervention de la Dr. Etches sera la gestionnaire du programme d'immunisation, Marie-Claude Turcotte. Following the remarks, we will take questions from the media. A friendly reminder to please keep your microphone on mute until I invite you to ask your question. Veuillez désactiver votre microphone jusqu'au moment de poser votre question. I'll now hand it over to Dr. Etches. Dr. Etches, c'est à vous.
Well, hello, bonjour, Quay. We are turning another corner in our COVID-19 response as we anticipate approval for the vaccine for children aged 5 to 11 very shortly. And earlier today, Ottawa Public Health released more details on the plan in Ottawa to vaccinate children in this age group. So first, I want to address a question that I've heard from many parents. Should I get a COVID-19 vaccine for my child or should I wait? And my answer is this. Once the vaccine is approved for children 5 to 11, then don't wait. Though it's only vaccines that are proven to be safe, effective, and of high quality that are authorized for use in Canada. Alors, premièrement, je veux répondre à une question que j'ai entendue de plusieurs parents. Est-ce que je devrais vacciner mon enfant contre la COVID-19 maintenant ou est-ce que je devrais attendre? Ma réponse est ainsi. Dès que les vaccins sont approuvés pour les personnes âgées de 5 à 11 ans, ce qu'on anticipe très bientôt, n'attendez pas. Seuls des vaccins qui font preuve d'efficacité et de sécurité, et si ceux qui sont de haute qualité sont autorisés pour l'utilisation au Canada. COVID rates are highest and growing in this age group in Ottawa right now. And with the introduction of COVID-19 into schools, it's leading to disruption in learning and work for many families. So once approved for children 5 to 11, booking appointments will be done through the provincial booking system, not through Ottawa Public Health. Appointments for this age group are not yet available, but we want parents to know that this information is coming soon. As soon as we know the supply will be delivered, we can put up the appointments for when we can start to deliver it to people. So when it comes to where your child can be vaccinated, a variety of options will be available. Concernant les endroits où votre enfant pourra être vacciné, plusieurs options seront disponibles. In addition to the currently operating community vaccine clinics, those are the large clinics, 3 more community clinics will begin operations to accommodate the additional demand for COVID-19 vaccines when this age group 5 to 11 is approved. And more information about these clinic locations can be found on our website now. And within the first week of receiving vaccine supply, Ottawa Public Health will open after hours school pop-up vaccination clinics at different schools over 4 weeks. The after-school pop-up clinics will have capacity to immunize up to 10,000 children per week. With the majority of the capacity to immunize in the community clinics, this is an option for people who may not be able to get transportation to the clinics or who have a desire to be immunized closer to home. A total of 73 after-hours school pop-up vaccination clinics will operate on a staggered schedule over those 4 weeks, and it will be across the city to make it easier for children and their families who may not be able to use the provincial booking system or who feel comfortable in their school environment. And I also want to clarify that families may bring their children, if they have multiple children in this age category, at the same time if they make an appointment for one child. We want to accommodate families that way. So now to parents and caregivers, also, I want to assure you that no child will be given a vaccine without your consent. Parents know their children best, and our role is to provide the information required for them to make an informed decision with their child and for their child. So we do recommend that anyone who is eligible to get a vaccine do so. When we have that information from the National Advisory Committee, we'll be sharing exactly what those recommendations are. Un mot maintenant aux parents et proches aidants. Je veux vous assurer qu'aucun enfant ne se faire vacciner sans votre consentement. Les parents connaissent leur enfant et notre rôle est de fournir l'information qu'ils nécessitent afin de pouvoir prendre une décision éclairée. Nous recommandons que toutes les personnes qui sont admissibles à la vaccination approuvée vont se faire vacciner. The school clinics will be held after school hours, and no child will be given a vaccine without parental consent. So we understand that parents do have questions about the vaccine. We were asking what those questions were, and so please visit our website for the most up-to-date information about the COVID vaccine for children. We're turning the information that parents shared with us into a frequently asked questions section with answers that they'll be fleshed out further, more details as we get them from the National Advisory Committee on Immunization. That committee is the one that's examining the safety and the effectiveness of the vaccine in the context with what COVID-19 infection means for children and what the risks are for children from infection. As well, our nurses will be available to answer your questions by phone or in school environments and at the vaccine clinics. So for more information, please visit ottawapublichealth.ca/child COVID-19 vaccine. Ottawa, you have been exceptional when it comes to our vaccination rates. It's currently 88% of the eligible population that is fully vaccinated. Jusqu'à présent, 88% de la population éligible est complètement vaccinée, and that deserves to be recognized. It's less than a year since the first dose was given. And while this number will go down temporarily as we expand eligibility, I have confidence that our vaccine coverage rate will come back up in the coming weeks as it's offered to children. And I know that this protection makes a difference. In recent weeks, Ottawa's assessment centers and care clinics have seen a growing trend of residents seeking a COVID-19 test 5 or 6 days into experiencing symptoms, whereas previously people would present for testing after 2 days or 3 days. So delaying testing can add up to a growing risk of community spread when people don't realize it's COVID-19, and it can add to the pressures on our healthcare system. So I want to remind people, if you're experiencing COVID-19 symptoms, it is important to not wait to see if your symptoms improve. If it could be COVID-19, please book a test immediately. Si vous avez des symptômes de la COVID-19, n'attendez pas une journée ou deux pour voir s'ils s'améliorent. Prenez votre rendez-vous pour un test de dépistage de la COVID-19 immédiatement. And again, the ottawapublichealth.ca /COVID testing site is there to help you book an appointment and get tested as soon as possible. And if a test is needed for a school-age person, they are available in each school. So lastly, I know that many people have started thinking about the holidays and gathering with loved ones, myself included. And we are in a much different situation than we were at this time last year. Vaccines provide excellent protection against severe illness, hospitalization, and having to be admitted to an intensive care unit. I want people to know that it is 2 doses, and now for older adults, a 3rd dose that we want to see people have to have good protection against transmission and severe illness. And so as we prepare to vaccinate younger children, again, this will add to the protection, but they won't be fully vaccinated with 2 doses before the holidays. I want to encourage people to proceed with caution, check on the aspects of the gathering and choose the lower risk option. Malgré que nous sommes dans une situation beaucoup plus différente cette année autour du même temps de l'année dernière, et surtout lorsqu'on se prépare à vacciner les jeunes enfants, je veux dire aux gens de demeurer vigilants durant cette saison festive. So that means to assess the risk of people who will be gathering. Consider everyone's vaccination status. And if you choose to attend a large gathering with others or where people are unvaccinated, maintain a physical distance and wear a mask if this might be difficult. The other things we can do include holding activities outdoors and opening doors and windows every so often to increase ventilation. We have more tips on safer gatherings on our website. So merci, thank you. I'm happy to take your questions. Miigwech.
Donc, merci beaucoup, Dr. Etches. Thank you very much, Dr. Etches. Just a reminder, we do have Marie-Claude Turcotte here available to answer reporters' questions as well. Nous avons aussi Mme Marie-Claude Turcotte qui serait disponible pour répondre aux questions des médias aussi. I'll now invite each media agency in alphabetical order to ask their questions. Please remember you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question ainsi qu'une question de suivi. We will start with CBC News Ottawa with Matthew Kupfer. Matthew, over to you.
Hello. First, maybe just this is there's audible excitement in your voice there, and I was wondering if you can just address, maybe perhaps as a parent or personally, how you are feeling about what seems to be the impending approval of the vaccine for children 5 to 11.
You're right. I feel this is good news. An approval means we have a safe and effective vaccine that's recommended, and I think that this is the population, that is having the most disruption to their lives right now. People 12 and above who are vaccinated have more comfort accessing other services and supports. They can feel more confident. They're not going to pick up COVID and pass it on to someone as easily, and they're not having to repeatedly isolate from school or miss out on their essential supports, which school is for children. And so I think this will make a tremendous difference, not only for the children but for families and people's ability to work. Yes, I think this will certainly improve people's well-being, and that's a good thing at this time where parents and children have been through a lot.
Thank you. Follow up.
I guess what additional information can you provide? Maybe if I just frame it this way, I mean, how does this plan that you started rolling out today build on or learn from what's happened in the previous phases of the vaccine rollout? And I suppose that's open to both of you.
Yes, I'll start, and if Marie-Claude would like to add anything, please do. What we saw in our vaccination campaign to date was that it was important to provide people rapid access through as much capacity in a large clinic as possible right away. And so that's why we're going from 4 clinics to 7 larger clinics right away. And we're putting up all of the appointments, all necessary to reach the 77,000, 5 to 11-year-olds. So that people will see those appointments are there for them and they'll be able to get a spot. And we learned that those clinics aren't sufficient to reach everyone, and that there are real barriers that communities, especially we know communities where there are other pressures, people don't have the same childcare or transportation or time in the day to be able to get to a large clinic. It's important to bring vaccination options closer to them. And so we've seen that in communities. We know which communities it's been helpful to bring vaccination closer. So we've been using that information to plan the school-based options. We also know where COVID rates are higher, and we did do this originally. We tried to make sure there were options for neighborhoods where COVID rates were higher, to focus there to make sure the protection was as high as it could be from vaccination. And so this is why we're continuing with neighborhood hubs where people can just walk in and they're focused on people who live in certain neighborhoods. That's continuing. So we see that need will likely continue for children and youth. We know from the previous work, it takes many, many partners. So I just want to pause for a moment just to say, again, the hospitals are helping, the city is helping. CHEO Kids Come First are helping, the community health centers, the Ottawa Health Team, the school boards have been significant partners in helping us use their space and identify where we should be. So this all of community approach, again, I think is really something we've learned and we've built on. Marie-Claude?
Thank you. Thank you, Dr. Etches. So Dr. Etches covered a lot of the grounds, a lot of the learnings that we had from the first phase of the rollout. The only thing I would add is that we've also learned that people have questions and they want to be able to have the information so that they can make an informed decision. And I think that will be even more important with the rollout for children. Parents want to know the information, they have questions, it's normal, and our nurses are equipped to answer those questions. So that's the other learning I would add.
And then there's something else that, of course, we have done to change our approach, which is to recognize that we are immunizing children and there are child-friendly approaches that we need to use. And we have experience in that because we have immunized children under 5 before for flu and 5 to 11. And we have, I could elaborate, but we've really also taken learnings from immunizing children and applied them to the COVID campaign.
Thank you both, and thank you, Matthew, for your questions. Next up is City News Ottawa, Alex Gouge. Alex, over to you.
Hello, my question is for Dr. Etches today. Dr. Etches, I was just wondering your thoughts on the Ford government allowing symptomatic testing in pharmacies.
Thank you. I understand this is a provincial program with, I think, a good objective of making COVID testing more available to people in more locations, make it accessible. I think that is something people are looking for, to make it easy as possible to get a COVID test. I also know it's important in considering people may have symptoms, may be infectious, that the infection prevention and control measures are in place. And so I do believe that the provincial government is going to require certain infection prevention and control measures, and I do think that will be important.
Thank you. Follow up?
Yeah, and just going over to vaccination for kids, what support, I know you briefly mentioned this, but what kind of supports would be in place, especially for those children who have fears of getting needles who might cause a bit more issues at the vaccine clinic?
Sure, I'm happy to start. And again, Marie-Claude probably has even more detail to add. I think it starts before people come to the clinic. So we know that children between 5 and 11 can differ in their ability to be part of the conversation, but usually they should be informed and have a chance to have their questions answered before they show up at a clinic. And I think it makes sense to talk that through the benefits of the vaccine and to role model. So if parents have had their vaccines, that helps with encouraging the children to be vaccinated. If parents haven't yet had their vaccines, they can get them with their children. So that would be another thing that you could role model right in the clinic. If you haven't had your vaccine yet, you can show your children that. And then we know that parents play a big role in being able to comfort children at the clinic and distract children. So our nurses are trained also in comfort and distraction techniques. They will be able to assist parents in how children are held if they're younger, and in how to use these techniques. We also will have numbing spray, so to take away, the sensation of being given a needle. That can help some children. I think it is also important if there's a very severe phobia of needles, that we have an accommodation form that people can fill out. Once they've booked an appointment, they have an appointment on our website. There's an accommodation form if people have specific needs for a quiet space, a different kind of setting, that is something we can look at accommodating. When you fill that form out, then the OPH team will be back in touch. Marie-Claude, did you want to describe other things that we're doing in the clinic setting to make it easier?
Yes, thank you. We've also, so our clinics, we have, we know some children will benefit from a quiet space when they get the immunization. So they'll be able to be provided that space in the clinic so that they can receive the vaccine with their parent in a quiet space. We've also designed stickers for children so that they can proudly show other ones that they've been immunized. As Dr. Etches said, we're looking at different distraction techniques that can be used to distract children as they're receiving the vaccine.
Thank you both, and thank you, Alex. Next up is CTV News Ottawa. I'm going to go to Josh Pringle. Josh, over to you.
Thank you very much. My first question is for Dr. Etches. Was the report suggesting the COVID-19 vaccine for youth will be approved tomorrow? If that happens, when would OPH be prepared to start getting doses into arms? Are we talking as early as next week you could be ready?
Right, so normally what we would need after the federal approval and recommendations, what we will need is the provincial decision about what the program will be in Ontario. So exactly how they will recommend, what the interval might be between first and second doses, we anticipate, and we will need the supply. So we need confirmation that once it's approved, it will be shipped to us and in our fridges. And we understand that could be within the week. And so we are setting up to be able to vaccinate children once we receive that supply, possibly within the week.
And my follow-up question, just switching over to schooling. Elementary and secondary school students have been attending in-person learning since September. And this week, both CTV and CBC have had stories of university students at Carleton and the University of Ottawa talking about how the majority of their classes are still virtual. Do you feel it's safe for universities and colleges in Ottawa to offer in-person learning to all their students? And does Ottawa Public Health offer any guidance to post-secondary institutions when it comes to in-person learning?
Yes, I want to thank universities and colleges for being so flexible during the pandemic. I think the universities and colleges have often set a standard for being safe and creating safe environments. I'm thinking about the vaccination policies that our universities and colleges have stood up. And so with people having to be vaccinated on campus, this does create a much safer environment where it is possible to return to more in-person learning. We were talking with our colleges and university partners to describe how we do recommend that there would be a gradual lifting of capacity limits and a return to in-person learning. That means that physical distancing requirements would be eased, in classrooms, in laboratories, in libraries, indoors. We have also said that where you can continue to maintain physical distancing as you decrease the capacity limits and balance this return to class, that it's still useful. When we're looking at COVID, we know vaccination isn't perfect, so it's multiple different measures we want to use altogether. So of course, indoor masking is still one of the measures that makes a difference. But yes, I guess the bottom line is we do feel comfortable with increasing capacity in classrooms.
Thank you, Dr. Etches, and thank you, Josh. Then we go to Ottawa Citizen with Elizabeth Payne. Elizabeth, over to you.
Hi, thank you. For Dr. Etches, please, can you tell me what the number is? Maybe I should know this, of this population, and do you have any information or any inkling of what the rate of acceptance of vaccination could be among that group?
Yes, it's 77,000 people in Ottawa are between age 5 and 11, or including 11-year-olds. And we think that the uptake should be good. When you take a look at how older children and youth presented for the vaccine. We have 96% of 12 to 17-year-olds who sought their first dose, and 91% 2 doses. So I think this is a good indication that parents are seeing value in protecting their children, both against the disease and the infection, which can have long-lasting impacts. Also to create the opportunities for children to stay in school. They don't have to self-isolate if they're vaccinated after an exposure. Also to join in extracurricular activities. Many sports organizations have required immunization to participate. So there are many advantages for children and youth, and I hope that this is something we can accomplish together.
Thank you. And for a follow-up, and also I may be asking you to repeat yourself, so I apologize if that's the case, but I just wondering if you can go over for me what the various venues where children are going to be able. I'm a little confused about whether that also includes family doctors, for example, hospitals, things like that. And maybe as an extra add-on, you can tell me whether Ottawa is doing anything like they are in Toronto with superhero selfie stations and things like that to make it fun. So.
Sure. No, I may partially repeat myself, but I don't think I actually laid out all of the options for vaccination. So happy to do that. I'll start with the highest volume. So the options for immunization begin with community clinics. Those are our mass clinics, our large clinics, which will be 7 different sites listed on our website. There will also be pharmacies, which I think could be a significant channel. We'll see some parents will use pharmacies because they're close to home. Some parents not as comfortable. So that's one additional option. We will have the school-based clinics for 73 different schools that will serve an area around the school. So just because it's in a particular school, 73 over the course of 4 weeks, it doesn't mean it's only for students from that school, but it'll serve a geographic area. I also didn't describe exactly how that would work in terms of presenting and finding a spot. They will be advertised a few days ahead of time with school nurses in those neighborhoods to let people know the clinic's coming up. They'll be outside the schools in that area. Our nurses may even be going door to door to let people know. And they'll be able to hand out cards, appointment cards that will spread out the times that people show up at the school clinics, just to handle, and try to avoid some of the lineups that could otherwise occur. There will be a walk-in option for those as well. They're meant to be low barrier for people in those neighborhoods who that's the best option for them. We still have 10 vaccination hubs operating in 10 neighborhoods. They're listed on our website, and they are also walk-in for people who live in that area. And when it comes to family physicians and pediatricians, the largest contribution they're making numbers-wise is in one of these venues. They're working in our large clinics, working in mobile clinics, working in vaccination hubs, and in schools. So we've had great support from family doctors and pediatricians to join in that effort. And there are some, I think we don't have final numbers yet, but some family physicians who have said they will immunize their own patients. It's probably something you could check with your family physician to see if that's a service they're offering. I think I missed a couple more. So I mentioned hospitals are involved. CHEO is running a special clinic for medically complex children for their patients. And that is something they'll be doing at their site. And they'll be letting CHEO patients know about that. And hospitals are currently immunizing healthcare workers. So the other hospitals, the Ottawa Hospital, Montfort, the Queensway, they're immunizing healthcare workers. And if they have capacity, they may extend that also to children of healthcare workers who are presenting. So it really is a lot of different partners. Again, I mentioned the Ottawa Health Team helping out with some of the more mobile options. So there are some homebound children who can't get out, and the community health centers are helping with that. Lastly, the Indigenous population is being served by Indigenous health organizations leading the way. So Wabano, for example, is running a clinic for First Nations, Inuit, and Métis children. And this information is all on our website. So when in doubt, check ottawapublichealth.ca/COVID child COVID-19 vaccine.
Great, thank you.
Oh, superheroes. Yes, we do have superhero posters ready. They're ready to go. They'll be there in the clinics. People will have their sticker and they can stand in front of some of these child-friendly posters and signage.
Thank you very much. And thank you, Elizabeth, for your questions. En dernier, on a Radio-Canada avec Benjamin Vacher. Benjamin, c'est à vous.
Merci beaucoup. Bonjour, Dr. Etches. On voit du côté d'Ottawa qu'il y a quand même que les nombres de cas sont quand même encore assez élevés. À quel point vous pensez que la vaccination des 5-11 ans, ça va permettre de diminuer les cas qu'on a actuellement et notamment aussi les hospitalisations parce qu'on a 20 personnes hospitalisées aujourd'hui?
Parce que la vaccination fournir une bonne protection contre la COVID-19, ça va aider d'avoir vaccination cette population de 5 à 11 ans. Heureusement, les gens dans cette population ne présentent pas souvent, c'est rarement qu'ils ont les maladies sévères. Alors, ça prend temps quand il y a transmission dans la population plus jeune, avant que ça touche la population plus vulnérable. Et maintenant, le nombre de personnes dans les hôpitaux sont presque stables. En fait, il y a des gens dans les hôpitaux qui sont touchés par la COVID-19 à cause d'une éclosion. Alors, c'est pas exact, ce n'est pas une réflexion de toute la quantité de maladies sévères dans la communauté. Aussi, je ne sais pas si ça c'était clair. Mais pour moi, ça va prendre quelques semaines après une vaccination d'avoir la protection. Alors, on a besoin d'attendre pour le système immunitaire d'être fort après une vaccination. Alors, ça va prendre temps de voir l'impact concernant la vaccination de cette population. Aussi, d'avoir le niveau de protection plus haut, ça prend 2 doses, j'imagine. Ça va être vérifié par les recommandations du gouvernement fédéral. Et la deuxième dose, ça arrive dans l'année prochaine, en janvier ou en février. Alors, c'est probablement après ça, on peut voir la bonne production que j'espère on peut avoir avec plus de protection. C'est pourquoi je continue de recommander qu'on porte les masques et faites attention pour les fêtes en décembre, parce que c'est bon d'avoir une dose, mais ce n'est pas toute la fin de l'histoire concernant la transmission de COVID-19.
Merci beaucoup, Madame Etches. Puis une question de suivi. Vous dites que vous avez besoin des parents. Certains vont être d'accord pour venir, mais certains vont avoir peur d'emmener les enfants, même si eux sont vaccinés. Les 5-11 ans, parce qu'ils sont petits, ça inquiète beaucoup de parents. Comment vous allez aller les chercher, ces parents-là?
On a un site web où on va fournir les réponses aux les questions comment. C'est une méthode, mais aussi on a besoin d'avoir les différents lieux pour discussion avec les parents. Alors, pour quelques parents, c'est une discussion avec leur médecin. Pour autres parents, peut-être c'est une discussion avec des leaders dans leur communauté. Une église ou avec un imam. Alors, on va fournir beaucoup de partenaires avec l'information et les recommandations de santé publique pour partager l'information avec des parents dans leur cercle. On va aussi avoir les grandes présentations en ligne. On utilise YouTube, par exemple, et c'est important que ce n'est pas juste moi qui parle, mais les experts dans la santé des enfants, les médecins qui prennent soin pour les enfants. À CHIO, par exemple, on a des plans d'avoir les événements pour les parents et les enfants aussi. C'est bon pour les enfants de voir les questions et les réponses comment aussi. Mais Marie-Claude, est-ce que vous voulez ajouter quelque chose?
Oui, en fait, un peu ce que Dr. Etches disait, c'est vraiment de donner l'opportunité aux parents de poser leurs questions. S'ils ont des inquiétudes, nos infirmières sont disponibles sur les lignes téléphoniques, nos infirmières sont disponibles dans les écoles aussi pour répondre aux questions des parents. On sait que les parents ont des questions, c'est normal et on s'en attend. Nos infirmières sont équipées pour répondre à ces questions-là. Donc, vraiment de s'assurer qu'ils ont toute l'information nécessaire pour pouvoir prendre la meilleure décision.
Merci.
Alors, et voilà. Merci beaucoup, Marie-Claude. Merci beaucoup, Dr. Etches. Thank you very much, folks. Lots of valuable information shared today. And we want to thank you, our media partners, for all your ongoing support. And it's because of you folks that we can get this message out to the residents and parents who need to have this information. That's all the time we have today. Merci beaucoup. Au revoir. Bonne journée.